Hi, everyone. Thank you so much for being here for the second offering of our Go Mobile, introducing the Mobile Apps for Capacity Management Suite webinar. Last time we had this session, it was one of our best performing and best attended sessions. So you are in for an absolute treat today. So thank you for spending a few hours with us here, whether it's your morning or afternoon. We're just honored to have you here with us today. So we have a jam-packed agenda, so I am not going to be talking very long, and I want to hand it over to our presenters, Jamie and Reagan. But I do need to talk through some things with everybody just to make sure that we all know the housekeeping items and then give a brief introduction or overview of both of our presenters for the session today. So the biggest question I get is, will the webinar recording and slide deck be available for everybody who's here today after the session? Absolutely. We probably will send that email out late today or early tomorrow. It takes a while for those recordings to come to us and for us to get them into our system and posted. So yes, you will be receiving an email from me. My name is Kaylee Fontana. I am the campaign manager here at TeleTracking. So if you don't happen to receive that, please feel free to go ahead and send an email to marketing@teletracking.com, and I'll make sure to send those pieces of information over to you. Sometimes our emails can get stuck in spam, so that may also be a place that you would like to check. So like I mentioned, the last session that we had for this, I believe we had 88 questions. So that was quite interactive, and we still want you guys to feel like you can ask questions throughout the session. So if you do have something that you would like to have Reagan and Jamie discuss, please make sure you go ahead and put those questions into the Q&A panel over here on the right-hand side of the WebEx console. And we're going to go ahead and collect all of those and answer those at the conclusion of the event. We may not get through all of them, so we will be posting a follow-up blog that has answers for all of the Q&A. So that's another piece of material that we can send you at the conclusion of the event too. So again, final questions. If you need anything from us in the meantime, feel free to go ahead and send an email to marketing@teletracking.com, and we'll go ahead and try to answer any questions that you have within 24 hours. So if we could go ahead to the next slide, we're going to introduce presenter number one. I'm sure most of you on the call are familiar with Reagan. She is a fantastic member of our team. Reagan is the solution line lead for TeleTracking's mobile application solutions. She has been with the company for over 3 years now, working within various product lines. Prior to TeleTracking, Reagan worked as a biomedical engineer for a division of the FCC. In that role, she provided SAR engineering support to the world's largest wireless electronics providers. And the second person we have today on the call is Jamie Slater, another person you probably are all aware of as well. As part of the mobile team, Jamie conducts user research, designs the user interface and user experience of applications, and collaborates with the engineering team to bring the mobile solutions to life. Jamie has been with TeleTracking for almost 2 years. Prior to TeleTracking, Jamie has consulted as a design strategist for companies within healthcare, manufacturing, insurance, and the banking industry. So not sure you could have any better presenters on this session today. So we'll go ahead and hand this over to them shortly. But real quickly, just wanted to go over the objectives for today's session. Number one, we're going to go ahead and review the mobile apps portfolio for Capacity Management Suite. We're going to articulate the features, designs, and benefits of the mobile apps, and then also do an in-depth demonstration of the executive, patient flow, charge nurse, and the bedside nurse apps. So without further ado, I'm going to hand it over to Jamie and Reagan. So Reagan, if you would like to go off mute, I will pass the presentation to you now.
Yep. Yep, thank you, Kaylee. Can you hear us?
I can hear you, yep.
Okay. Thank you for the great introduction. So as Kaylee said, we're going to give you guys a brief introduction here of why mobile is so valuable and why we're focusing on it here at TeleTracking. Jamie will go through some awesome design information with you, and then we'll do a quick demo and get to question and answers. We want to make sure we give you guys a lot of time to ask questions at the end. But just really quickly here, just a quick introduction. You know, I'm not going to read this slide to you, but why things are so important as far as mobile goes, specifically in healthcare, and more specifically here at TeleTracking. As you know, our core mission is to ensure that no patient waits for the care that they need. These mobile offerings directly tie into that. Really what we're trying to do is allow for both your operational leaders and your clinical caregivers to spend less time sitting behind a desktop or, a computer on wheels somewhere, and spending more time doing what they're supposed to be doing, which is caring for patients. Also trying to give them, more time back to be able to optimize their work and do more work throughout their workday. So really allowing them to manage operations in real time or do any kind of clinical rounding, or today we'll be focusing on the clinical applications, any kind of clinical work that they need to do throughout their shift. Also, really trying to focus in on being able to coordinate among your staff, right? Again, just trying to make them to be more proactive opposed to reactive. Quickly, we're going to go through what we mean when we say the new mobile portfolio here at TeleTracking. Some of you may know TeleTracking has been involved in the mobile space for about 7 years now. We have a mobile XT application, which you may or may not use, which is geared toward your EVS and transport teams. We've also had some other apps out there over the years, one for our community access portal, and then also one for our clinical workflow suite application. Really what we've done in the last year, and Jamie will go through this, is we've built a common mobile platform using React Native. And on that platform, we have introduced now, just as of this February, 6 new mobile applications for these various different roles. Our last webinar was focused on EVS and transport roles. At your request, we will be focusing in on our executives, patient flow managers, charge nurses, and bedside nurse apps today. Jamie will be going through your executive app, and this is really, intended for your upper-level C-suite members, just to give them an understanding of what's going on at their healthcare system currently. Your patient flow manager, this is geared towards like your house supervisors, and it's really intended to marry a lot of that clinical and operational information that our capacity management suite provides today, to give this house supervisor, patient flow manager an understanding of where the bottlenecks exist, to help to alleviate some of that pain and produce operational efficiency. Our charge nurse app I like to refer to as like a air traffic control application for your nursing units. And really what this is intended to do is give your charge nurses an understanding of the units that they are in charge of currently, who's coming and going from those units, current bed status, and also some patient information as well. Your bedside nurse app is geared towards your staff nurses who are assigned patients. And as you will see, if you are using staff assignment as a part of our capacity management suite, the information in this application will be showing you those patients who are currently assigned to you. We can certainly at the end go over our EVS and transport pieces if anyone has any questions, but for now I'm just going to leave those out. I'm going to pass it off to Jamie.
Perfect. So let's talk a little bit about the mobile platform design. And essentially, we designed one platform that can contain all 6 of these applications. So there's a very similar look and feel and interactivity between all 6 of them. So we've built this for design consistency as well as cross-platform framework. So that really speaks to that all 6 of these applications are available on both iOS and Android. And we also tailored to specific roles within the hospital for a more kind of simpler experience for those roles. So you can see that each of those 6 is designed specifically for a role within the hospital system, just showing them what is relevant to them instead of a lot of information that is relevant for a lot of different roles. And the last piece here, mobile apps meet mobile accessibility guidelines. And this is related to the web content accessibility guidelines, and a lot of federal websites and others follow these guidelines, essentially things around touch target size, color contrast, type size, all of those good things that make our apps more usable. So all 6 of these applications follow those requirements. Go to the next slide.
Okay, so we are going to switch to the demo here.
Just give us 1 second while we get our mobile device up on the screen.
That shows here. Hey, Kaylee, can you confirm that you can see the mobile app on the screen?
I can. It says Dashboard Health System Overview, 4 campuses total.
Cool.
Perfect. All right, cool. So I'm going to go through this application. This is our executive application. You can kind of think of a nice analogy for this might be your weather application. How are things doing today? So your executive would kind of sign into this. I would say their health system at the top, and as well as they would see how many campuses are basically related to a good status, warning status, or kind of a critical status. And these are all related to census information that we're pulling from CMS. So we can kind of quickly, this is just kind of one feature within a lot of these applications where you can switch the view to a bar chart where it gives you good caution and warning kind of data and just a different view of the exact same information. If I want to just look at, let's say, the caution kind of campuses that are within my health system, I can click into that bar chart and it'll just show me a list view of all the things that are within caution. You can see these little filters up at the top, let me kind of change what I want to look at. I can add all the things back into it and it'll kind of display all the campuses within the list. So you can see these are all the campuses that would be within that health enterprise, and it's giving you essentially census data by percentage for each of those campuses. And there's also a threshold related to each of those, so you can see how close you are to the next kind of stage. If I want to kind of manage this regional campus, I can click into that, and it'll take me to a campus overview where I can see, the high-level census there, and I can see ED status at a high level, so you can see patients waiting in the ED currently. We can see that there's 14 of them, and that we are 1 patient away from our threshold limit. And we can see the longest waiting patients in the ED, and we can see that there's currently a patient that's been waiting there a very long time. And this is a demo system, so there's going to be some data that's not very realistic. On the third one here, there's going to be average waiting time today in the ED, and that's just calculating all the patients who are currently waiting in the ED and making an average of that amount of time. As you can see, probably that 47 days is really throwing off our average. The last one down here, bed turn time, is essentially an average time for all the patients who've gone through the process. So they've gone from being discharged, that bed has gone from being discharged to a cleaning request to being cleaned and then getting a new patient. And so it's taking that time period from A to B and calculating that for all of those situations to give you an average bed turn time today. One additional thing for this campus overview, I can click into the census chart and it'll break down that campus by unit category. And that's something that can be configured. Typically, health systems are kind of using those unit categories to represent hospital service, things like ED or the cardiology unit. If I would go to notifications up at the top, you can see I have 18 notifications. So all of those items that I can, all those data points within that campus overview, like average waiting time, patients waiting in the ED, every time one of those thresholds is crossed, I'll get a notification about it here on this page. So I can take a look at that. I can view that notification. You can also see if you are configured for this, I don't think we'll go into detail about this today, but you can see the message button there. If I press that and I was configured for our third-party communication vendor mobile heartbeat, it would open that application and let me speak to my care team about that notification. Let's see. And as you can see, that's about all the data that's within the executive application. If I go to settings, I can see I can do web configuration. I can get a little bit of about information, just very high-level things like what's my version, some legal information. And on the settings page, I can also switch to a dark theme that just lets me view the entire application in a different color theme. Basically a user preference. And this is also where you can sign out. So at a high level, that is all the kind of data points and information for that executive app. It's definitely high-level data points. It's kind of the health of your enterprise at any given point in time.
Yeah.
Anything else?
I think
I think we'll move on to our patient flow manager application, and Reagan's going to walk through that.
Thanks, Jamie. So take you back to the home screen here on the mobile device. As you can see here, just before I log in, just want you guys to take a look at the different app icons that we have there. I'm not sure if we went through that during the first one. So yeah, the one that Jamie was just in is on the bottom lower left. That's your executive. I just want to give you guys a little bit of a view of what these icons would actually look like on your screen if you were to download the app. So I'm going to go into the patient flow. And all 6 of these apps, you would have to log in via username and password. Give me 1 second. This app does have a lot more data than the executive app that Jamie just went through, so just bear with me. I'll try to go as slow as I can. So what you're seeing here when I just logged in is our version of the dashboard page for your patient flow manager or your health supervisor. You can see that there's a little bit more data on here, and it looks a little bit different from what you saw on our executive app. So typically we do understand that, your health supervisor may only be, typically in charge of 1 campus, maybe 2, because of demoing purposes, and I just want to give you guys a view of what this dashboard screen would look like. We do have this my permissions currently configured that I'm responsible for all campuses as a part of this health system. I do want to go through as well before we move forward. These filters that are here in the top navigation bar, you didn't see these in our executive app. Jamie and our design team implemented these as a way to organize some of the data because there's more in this application. So I'm actually going to turn off 2 of these filters here, and you can see what that simply does is it filters your cards here based on their current status. So when I say cards, current campus by current status, right? So we see that regional campus is the only one in the health system right now, which is in this cautionary state, which is indicated by red. So I'm going to turn those back on just so you can see how they work. And we're actually going to navigate into regional campus because I did build that out for this demo today. So as a quick view, here on your dashboard page, you can see some of the quick high-level information that we're trying to provide this health supervisor. So giving them an understanding of what the current census is of regional campus, which we see it's 91%. It's indicated in red because it's exceeded your threshold by 1%, which you can see in gray below that. You can see a quick glance of the beds and their statuses for this campus currently. So we have 7 available, 1 blocked, and 8 staffed. So by clicking on this green navigation arrow, I can actually go into a little bit more information about this regional campus. So again, carrying through that chart showing that we're at 91% census. And then we're also introducing this concept of incoming and outgoing, which you'll also see Jamie go through in our nursing applications as well. So let's define that really quickly. What is incoming defined as? So for those of you who are capacity management suite users today, we define incoming as any patient who has an incoming transfer to this campus and or an incoming pre-admit, right? So in either of those 2 buckets, they would be lumped into this category. For outgoing, pretty similarly, if you're using our capacity management suite and you're using our patient statuses of pending and confirmed discharge and or you're an outgoing transfer, you would be lumped into this outgoing bucket as well. So we can see at regional campus currently, we have 17 patients who are in this incoming status. So they're either an incoming transfer or they're an incoming pre-admit. We can see our average placement time today is at 21 minutes across regional campus. And then in outgoing, we can see that we have 7 patients who are outgoing, so either pending or confirmed discharge and or an outgoing transfer. We can see our average discharge time today is 9 minutes. Again, this is a demo system, so please do keep in mind some of this data may not be exactly realistic. So from there, we can drill in a little bit further to understand more details. So maybe I want to get an understanding, more about my patients who are both incoming or outgoing, and in this next list view here, we can do that. So we marry some of that patient information also with some of our operational information. We understand that it's not, our clinical leaders, but it's also our operational leaders, those 2 married together, which drive operational efficiency. So at the top here of this list view, you can see that we're again carrying through that high-level data, so your current census, current available beds, block beds, staff beds, and then at the top of that card, or at the bottom of that card, you can see go to bed list. And we will go into some of these lists here in a minute. I do want to scroll down first and show you some more information. So then we see our list is split out into, again, that incoming and also outgoing buckets. So in incoming, you can see the different patient categories that we have. We have incoming patients as a whole. We have incoming patients from our ED and PACU. Again, we're carrying through that average placement time metric today. patients with units targeted, and patients with bed assignments. And I will go into some of these patient lists here in a minute. For our outgoing bucket, we have it split into a couple different categories: patients with pending discharge, patients with confirmed discharge, patients with pending transfers, and then again carrying through our average discharge time today. Down here below is where we have some of that operational data which I was speaking to. So your house supervisor can also get an understanding of how their EVS teams and transport teams are performing as well. So you see for both of these metrics you have a response time and a turn time. For EVS, your response time would be an average across this campus, and it would essentially be from the time the job was sent out to actually responding, an average across all of those jobs for this campus. Same for your turn time. Your turn time would be, there's a bed that needs to be cleaned, the job's out there, we've actually started the job and the bed's actually turned over. And again, that would be an average across your campus. Same thing similarly for transport, how quickly your transporters are responding on average for the jobs that are out there, and then also, how quickly it's actually taking them to complete these jobs as an average as well. We'll come back to unit category in 1 minute. I do want to go through some of the bed and patient information. So at the top, we're going to go into our bed list here, and you can see that, if we had block beds, we would be showing you information about those block beds because we only have one. We may have one on this list right now, but essentially what we're showing you, is how long it's been blocked, why it's been blocked, and some more information about the bed. Maybe you need to unblock some of these beds to create some capacity. Then I'm going to go into some of our patient lists. So we know, incoming from the ED and PACU is a big one, so let's go in there first. Give you guys an understanding of some of the patient information that we're, serving up for this house supervisor. So you'll see here for this campus, it'll be providing you the top 10 longest waiting patients in these areas, right? And some of the information that we are showing is, how long this patient's been in this status, who they are, some general information about them. And a big piece of information here is if they have a targeted unit and a bed assignment. So if they did have those things, they would be showing there. I'm going to expand another card here to show you, some of the information and how it's consistent. I'm going to go into one patient list for our outgoing bucket, and let's go into patients with confirmed discharge. You'll see that when I expand this patient card here for Krista, you'll see that, again, some of the information we're carrying through is consistent, but there is an additional piece of information or data there at the bottom. So at the top, you see how long Krista's been a confirmed discharge, general information about her, her current location. If there's a target unit or bed assignment, that would be more relative if she was a transfer. But also, what's really important here, what we're adding is discharge delays. So if you're using those discharge or transfer milestones and you're actually inputting those into the system, they would be, input here and showing, and they would also show for how long they've been input into the system. So we can see that maybe, one of the reasons that Krista is not out of here yet is because she's pending test results, and then, we're unable to reach her family member. Just trying to give this user an understanding of, how could we get things moving. So I'll show you one more patient card just to show you the consistency again. You can see Tom here pretty similarly. He's been a confirmed discharge for 3 hours, 9 minutes, and then some of the delays associated with his discharge. Okay, so I'm going to scroll down all the way to the bottom of the page, and we're going to get to this unit category piece. So as Jamie told you in the executive app, we define unit category really as, service line. But what we're allowing you to do here as the house supervisor is drill down a level deeper. So we just looked at information relevant to beds and patients for a regional campus, but maybe I want to understand that same information about my service lines which make up regional campus. And we can see here that we have 2 defined, ED and cardiology. Let's navigate into cardiology here. What you can see here for cardiology is the same exact data points that we showed you for regional campus, but now they are relevant to cardiology, which is a service line in regional campus. Again, we have that incoming and outgoing bucket, the patients, and then average placement time today, and then outgoing patients, and average discharge time today. All the same data points I went through with you before. you'd be able to understand, bed status across the cardiology service line and go into your bed list. And then again, you'd also be able to understand relevant patient information, but specifically to cardiology. So patients incoming to cardiology, your average placement time today across cardiology, patients with units targeted, bed assignments, right, all geared towards cardiology. Same thing for outgoing. Your patients with your pending discharge in cardiology, confirmed discharge, any pending transfers, and then your average discharge time today. Again, all geared towards this specific service line. You can drill down one level deeper. So not only do we care about patients and bed status at the campus level and then at the service line level, but maybe we want to drill down even one level further and understand those units which make up a specific service line. So we started at regional campus, we drilled down to cardiology, we drilled down even one level further here, and now we're showing that there's 2 units that actually make up the service line of cardiology, which is our ICU and our step down. So I'm going to drill into our ICU here. And again, you can see that both our graphics and our data points and the way they're organized and designed here on the screen are exactly the same. The only thing that's different here is we're talking specifically for your ICU unit, which is a part of your cardiology service line. So again, drilling in here, I can see bed information for this ICU, patient information, both for incoming and outgoing. Again, carrying through all of those same metrics specifically for this service line. And that's as far as you can drill down for your patient flow manager. The only additional thing that, I'm going to show you, which Jamie already did, just to show you consistency, I'm going to click into our notifications tab here and show you, again, it's very consistent with what you saw before. This is where you would receive your notifications based on your thresholds. You would have that same ability to click on the message. If you had mobile heartbeat, you'd be able to do an in-wrap launch and be able to use their application to securely communicate. This view button is very relevant for this patient flow manager app. I went through a lot of data. There's the ability to drill down pretty deep into the data. So what I'd like to show you here is this view button should take me to the place in the app where this data point is relevant, where I can gather more information maybe before I talk to somebody about it. So opposed to pressing my back button several times to get to this piece of data, I can simply press this view button. And you can see that that notification was from some time ago, so it's not currently relevant. But this is where it would take me, where I could gather more information about that data point in the app currently. And then again, you did see this demoed all in our dark theme, but just to show you for consistency, you do have the ability across all 6 apps to change between light and dark themes. I'm going to sign out, and I'm going to pass it off to Jamie. He's going to go through our Charge Nurse app.
I think one thing that wasn't mentioned was the configuration of those thresholds. So it's kind of set per campus. You can change those to whatever percentage you would want or numbers that you would want for each threshold at a campus level. Cool. Already logged in here. Excellent. So what we're looking at here is our Charge Nurse application. And basically what it's going to do is give you, an overview of the beds within the unit that you are assigned today. So you're seeing that I'm assigned to the RMC pediatrics unit, that there are 10 total beds within that unit. And I can see that there is, 1 clean bed, 1 blocked bed, 2 dirty beds, and 6 occupied beds. And just like the other applications, I can change that to a bar chart if I prefer to look at the data in that format. Below there, similar to that patient flow manager application, you can see that I have incoming and outgoing patients as well. I have pre-admit patients or incoming transfers or outgoing patients as pending and confirmed discharges. So let's take a look. I can click on my list tab at the bottom. And that'll just take me to the list of those beds that I was looking at charts for. You're seeing there's very similar filters at the top, just filtering by the statuses: clean, blocked, dirty, and occupied. So I can see that I have a clean bed here at the top. You can see how long it's been clean, what is the size of that bed if it's a specialty. I can see the reason code, any reason codes associated with that bed, as well as if there's a next assignment or someone targeted to that specific location next. If I look at my blocked bed, I can see the reason that it's blocked for a behavior reason, and I can also see if there's a next assignment for that. If I look at my dirty beds, I can see that those are clean next. One is a clean next priority, one's a dirty priority. I can look at my dirty priority and see there's no additional information there for that. And also at the bottom here, I can see that there are occupied cards. So these, obviously, because they're occupied, have patients associated with them. So you're seeing bed information at the top, as well as patient information below that for Matt Reese. I can get a little bit more information about Matt Reese. I can see his current location, his patient status as in-house, any nurse that's assigned to that patient, their isolation status, and some demographics information. As you can see, essentially those are all of my occupied locations. I want to kind of click this top button here. It'll say, let me switch between, my bed list and my incoming and outgoing patient list. I'm going to go to my incoming patient list and view those two patients. So I can see one is a pending transfer and one is a pre-admit with an origin of RMC emergency department. So if I, click this, it'll give me those additional data points related to that patient. I can see, basic demographics like gender, age, and date of birth. Location information like bed assigned, medical record number, isolation, any diagnosis that we have, any patient attributes, and those are kind of specific information, as well as any physicians that are assigned to this patient, previously assigned nurses, and any pending transfers. If I look at Wesley Hammond, I can see very similar information for that patient, and you can also see those patient attributes showing for that patient, like one-on-one sitter and private care. If I go back to the top here, I can view my outgoing patients. And very similar to what you saw in the Patient Flow Manager app, we're bringing in those discharge delays for this pending discharge. We can see why they're why are they delayed from being discharged. And you can see that there's some paperwork incomplete. There's a family pickup for Izzy Sander. So essentially, that is the basic information. Your charge nurse is showing you all the bed and patient information for the unit that they're at today. If they had membership to, let's say, more than one unit, they could go to this unit selection page. And this particular is like an admin user that we have set up. So there are a lot of here. You typically would not have a lot of selections here, but you could switch between units if you needed to. And the same as Reagan was talking before, all applications can go into a dark mode. So, and that's basically it for that charge nurse application. Let me quickly switch to our bedside nurse application. And you'll see that, as Reagan mentioned earlier in this presentation, the bedside nurse application is based off of staff assignments. So any patient that is assigned to that staff or that location, and the nurse is assigned to that location, will pop up in this application as your user. So we can see this is the patient overview. I have 3 patients assigned to me today, 1 incoming, 1 in-house, and 1 outgoing. Very simple to change to the bar chart, just like the other applications. I go to my list view. I'm seeing something very similar to my charge nurse app, except it's just the patients that are kind of associated to me. And I can see that, it's all the same information for, Wesley Hammett that I got in the charge nurse application. Same for confirmed discharge. I can see those exact same delays. And also, one thing we didn't mention earlier, we also do show any pending transports. So you can see that any transport information. So this one, you can see that there's a pending transport job for this patient, that the destination is the MRI, and there's, how long that transport has been going on for. Once again, demo system, so some unrealistic data. That is about it for the nursing applications. You can see they're very focused to the patients and locations that are associated with that user.
Yeah. Okay, let me switch back to the top. All right. So really quickly before we get to, the questions and answers, Jamie, thank you so much for helping the demo here. We did just want to go through a little bit more, what are we planning next for this mobile portfolio, really what the vision is going forward at a high level. What you saw both of us demo today was really, just a start to what you're seeing here on this chart. Really for mobile to be valuable, we understand that, it's not only real-time data that we need to provide, but it's also being able to drive workflows and allow for our users to also securely communicate and receive notifications as a part of being able to use any kind of mobile offering in the healthcare space. So what you did see, is a start to really achieving this visual here, and that really ties back to all of those metrics that we talked about on, that first slide about, why mobile is important and what our goals are really for this mobile portfolio here at Tele. But, at a high level, this is really what we will be shooting for as we continue to mature this portfolio. I don't know if you have anything to add, Jamie, but if not, we can
keep going.
Switch to question and answer. So, Kaylee, we can turn it over to you.
All right, great. So if you do have questions, please make sure to put them into that Q&A panel on the right-hand side, again, of the WebEx console. So a couple of them have already come in, so let's go ahead and get started with those ones. Is there a max amount of campus filters that appear on the app?
There's kind of two ways I can understand that question. So one is those filters that are just below the header at the top. So typically those are kind of like the three states of the threshold. So good, caution, and warning. So green, orange, and red. And those are kind of preset as like three stage gates to either like a numbered data point or a percentage data point. And those are, as I said, kind of configurable by campus. The other way that I could take it is just like the number of campuses that we can show in the apps, and that's just completely based off of the membership of the user. So if they're, as for that patient flow manager app, if they're a membership to the entire health system, they'll see all the campuses. If they're a member to just two of the campuses, they'll just see those two campuses in their application.
Okay. And Roberto, if you have additional questions or if you need more clarification, go ahead and reply back in the Q&A section, and we'll make sure we pass that on. Okay, so the next one is, if a user already has a unit assigned in their user ID settings, do they still have to set a unit upon login? Do you want me to read that again?
Yeah, can you repeat it one more time?
Sorry.
Sure, no problem. So if a user already has a unit assigned in their user ID settings, do they have to set a unit upon login?
So essentially, Kaylee, again, this would be, dependent on how they're set up in their membership in CMS. You can be set up as either, a variable or fixed member. And then depending on how that is set up, if you are a variable member where you can select between units, that is something that from like the Capacity Management Suite desktop itself, they just as they would go through their normal login, they would identify which units they would need to select, and then that would then display on your mobile device. If they were a fixed membership, that is where that would not need to take place in your Capacity Management Suite first. That is something when they log into the app itself, it would be exactly like how we demoed today. They would just have to, choose which of those units from their fixed membership that they were working on today to view their information.
Yeah, and if they're only fixed to one unit, for example, they wouldn't have to make a selection. They go straight to the dashboard for that.
Yeah.
For that unit.
That's a lot. So if there's more questions, we can definitely answer more offline for sure.
Sure. And Mark, too, feel free to reply back if that answers, or if not, if there's additional questions you have, go ahead and type them in. Okay. Can the bedside nurse update patient attributes, mark patient as ready to move, and other functionality from the app?
Sure. Sadly, no. That is definitely on our roadmap for future enhancements. As Reagan kind of noted on that last slide, there's kind of three really important aspects of mobile: having real-time data, having communication, and having workflow. None of the applications have met that third one, workflow, just yet, but it is on our roadmap, and certainly Ready to Move is one of the high priority ones that we have on there. I'm not sure if patient attributes is, but definitely if you have opinions about which workflow actions we should tackle first, we'd be happy to hear those.
For sure.
Great. With the MHB messaging integration, is it possible to send a message to multiple people or a group message?
Yeah, so that is possible. So, and actually, I see that that's Anita Bowers who asked that, right?
Yes. Hi, Anita.
Hi, Anita. Yeah, so that is a capability actually of Mobile Heartbeat, and I believe Anita knows this, but I'll reiterate it just for her and everybody else on the call. So we actually have 2 integrations with Mobile Heartbeat today. One of them is, that inter-app launch where, from our messages tab in our app, you can actually press message and that will directly inter-app launch you into Mobile Heartbeat's MHCure app. And from there, that capability is something that Mobile Heartbeat currently has. So that is, definitely something that your users would be able to do, but is a Mobile Heartbeat capability.
Yeah. They usually they kind of let you build care teams that you can message.
Oh, great.
There's lots of robust functionality there, which we can certainly hook her up with the right Mobile Heartbeat contact to go through some of that.
Okay, great. Can additional column information be added to display on patient information? Example, 24-hour discharge plan follow-up needs. You want that one again?
Yeah, one more time.
Okay, sure. Can additional column information be added to the display on patient information? For example, 24-hour discharge plan follow-up needs.
So I believe what's being asked here is can different discharge milestones be added, and then can they display in the patient cards, which we showed you. So essentially, whatever discharge milestones, and I believe that's the question. I believe I'm tackling it correctly. Whatever discharge milestones, which are part of your capacity management suite today, as long as those are being marked, whatever they are, and there's a wide variety of different ones, right? As long as they're being marked, they will display there, and for how long they've been marked. I'm not sure if this person's requesting that as a part of the discharge milestones and or, additional data points, which can be, additional columns in portal. If that's the case, I'm not sure if we can show that information today, or we don't currently, I should say. But as far as discharge milestones go, as long as, they're marking that milestone, it should show.
Okay. And Carol, if you need additional clarification, go ahead and type back to us as well. In the Patient Flow mobile app, does the incoming list only include today's pre-admits or anyone with a future pre-admit to that campus or unit?
So it would be, and again, I hope I'm answering this correctly. We may need to talk offline, but it would be anybody with a current pre-admit for that campus.
Okay. And that was another one from Anita, so we can always follow up with her separately. Bedside Nurse app, future functionality requests, the ability to request patient transport from the app. So that may just be something that we want to write down as a future roadmap addition.
Don't any idea.
Okay, great. So we're going to take a couple more. Feel free to keep adding them in there if you, again, have something that you'd like to ask Jamie and Reagan. Just real quickly, what version of the Capacity Management Suite is required to adopt the mobile apps?
So today, in order to have access to all 6, and again, I know we only went through the clinical ones today, but we're talking about the 4 we showed today and EVS and Transport, a minimum version of 18.4, Capacity Management Suite 18.4 and above would be a requirement. So the minimum would be 18.4.
Okay. Also, is there a cost to adopt the mobile apps?
So today, as far as, software costs go or licensing goes, no. This is considered a feature of our capacity management suite or additional capability. You would need to, potentially upgrade your system, and there may be some kind of hardware cost associated with that upgrade. And also you would need to purchase your devices to support these applications. So, you know, as far as hardware goes, there could be a cost, but as far as software goes and INT, there is no cost from TeleTracking.
Okay, great. So if I am a current Mobile XT customer, how do I adopt the new apps?
So if you are a current Capacity Management Suite customer and you're not on at least 18.4 or above, I would recommend that you either reach out to either our marketing team or our Solution Center and request your upgrade. You'll then be assigned, you know, a project to upgrade, and as a part of that project, mobile will be included. You'll be assigned a technical project manager who will handle that upgrade. And as I said, as a part of that, that technical project manager will go through the checklist of items that your IT team would need to do in order to configure and install and deploy mobile.
Okay. And just to let everybody know, I'm actually going to be including a link to that upgrade request form in the follow-up email. So make sure you keep a lookout for that. But again, you're always welcome to email marketing or myself back, and we'll get you connected with the right person. So I think that's it for questions. So if you just want to go ahead to the last slide. All right, so I'm sure that was a lot to take in. That was a fantastic presentation as always. Thank you both to Reagan and Jamie. But if you have any additional questions and you would like to just look at some material related to the mobile apps, we have a fantastic resource center on our website, which is www.teletracking.com/resources. There's a really great search feature where you can just type in mobile app, and all of the content that we have related to that will come up. So we have a data sheet, and you also can reach out to us, marketing, or me, Kaylee, for additional information, like Reagan and I just said. And then we would encourage you to go ahead and schedule the upgrade to get these new apps and take advantage of them. So the link to that upgrade request form will be in the follow-up message. So just wanted to say thank you to everybody who was here today on the webinar. I hope that you found it beneficial. We do have a couple other offerings coming up, not related to mobile, but to feature our Synapse IQ solution and also Transfer Center IQ. So links to register for those two webinars will be coming in that follow-up email as well. We've had great participation and attendance in those, and people are pretty excited about those new solutions. So again, thank you for being here. We hope that you all have a wonderful rest of your day, and keep a lookout for that follow-up email from me. Thank you again, Jamie and Reagan. We really appreciate it, and have a wonderful day.
Thanks, Kaylee.